So today we are talking about Standard 7, which is community-based approach to service. Oh, we've got some more people jumping in now. Good. So Standard 7, community-based approach to service, which is, we are now 7 standards into our kind of going through every single standard and breaking them down in a webinar so that we have kind of a comprehensive point of reference for every standard found in the Iowa Family Support Standards. So if you're just new to joining us here recently, just know that the other 6 are out there on our website and can be out there to view, and that we'll just continue to plug along on these. So eventually we kind of have them all out there for people to view as needed when they have questions about a standard or run into some issues with it, or just want a little, to dig a little deeper on something. So at the beginning of every one of our webinars, we talk about, first topic is kind of this policy versus procedure and what that means, how we are, asking programs what we're looking for in policy and procedure as they relate to the Iowa Family Support Standards. And then what the peer reviewers are also going to be looking for when they go through everything for the peer review. So policies are kind of, they're more broad. And really, when we say policy in IFSTAN, we mean policy, but we're really looking for that policy and procedure. We want you to tell us what you're doing, but then also more about that how or when or who, those kinds of things. And so your policy is going to be broad. It's going to say more of that what or why you do what you do. It's kind of that general guiding principle. Those rarely change. Oftentimes, but not always, they're approved by the board, especially organizational standards or organizational policies. We'll see those were approved by the board. Maybe for programs, your program standards, so 1 through 16 or 1 through 15, I'm sorry, will be maybe approved by a committee or a group of individuals, kind of tasked with that process. But policies, like I said, they rarely change, and they say what you do. We conduct assessments, we initiate service plans with families, kind of those more broad things that are really the highlights of the standard. And the procedure is more that narrow application. So you're describing in detail in or processes, like specifically talking about the how, when, who. Those might change as you need to, as you tweak something. You find something works, something doesn't work. You need to change a time frame. You need to change a who does it. You need to change the name of a form. Those things might change. Oftentimes doesn't require board approval, but that'll again be up to kind of your organization and program and how that functions. And then as we move forward, we really are kind of in that process of asking programs to kind of get their documentation down on paper about what they do and how they do it, to include both of those things, both policy and procedure. And so in TA, that's the kind of TA you're getting is both pieces. And as we go through these webinars, you'll see this IFSTAN procedure boost kind of logo here. And that is really kind of those for those pieces that are, where we're lifting it up to best practices and we're asking for more. Those slides that you see that on it's kind of just an indication to you that these include those more of those specifics, especially, if your program and you're looking at your policies and your policy is really just what the standard says, that is definitely an opportunity for growth for you. And then those might be places where you want to look for these procedure boost logo here and kind of that'll help you identify what you need to do to kind of continue to enhance your own policies. The other thing to think about as you're looking at your policies just in general is the revision dates on policies and procedures. It's not required for the Iowa Family Support Standard to include these on there, but if you're a program that expects to, at some point in time in the future, go through the expedited renewal process, this is required. So you have to have a mechanism by which you track revisions to policies. And you can do a couple of different ways, and I've provided some examples here. But you can have kind of this type of thing, the procedure name, what it's applicable to, like this kind of thing, but this dates of revision, you have that at the top of every policy, and that's where you track all of those changes. Or you can have a supplemental document that has like the policy name, when it was effective, maybe those revised dates as they come up. So you're tracking all of the revised dates that way. One of those two mechanisms has to be in place, and you have to be able to show us that in order to be eligible for an expedited renewal. That is something that's been in policy for several years now, but we're really starting to dig into that a little bit deeper. We've given programs time to implement it, and so now it's a requirement going forward. And it has to be on a policy or procedure level. So I know a lot of times programs will track changes in a program policy manual, a program procedure manual, like as a whole, like the whole thing was updated, September of 2021. We're asking you to take that a step further and really track those individual pieces, like what changed, because that's what's important for us to be able to determine what standards are included in an expedited renewal. One of the things that are included there is standards that have changed since the last peer review. And in order for us to be able to determine what standards those are, we really need to be able to dig in and figure out what pieces. So if you have a whole manual that includes everything your program does, and you say, okay, well, that was last revised in September, then we're going to consider that to be everything. And that was changed in September. And what I bet you mean is maybe there were a few things in there. Maybe you changed an assessment frequency or something like that. And so if that's what you mean, then that's what needs to be tracked, is that assessment just itself, so that we just need to make sure to include those standards rather than everything. So, okay, now that we've talked for a couple of minutes about just kind of the general things that I think it's important to know as we look at these, let's dig into Standard 7. So Standard 7, kind of the first order standard, the way that it reads is it's a community-based approach, increases the ability of the organization and community to support children and families and meet their needs. So as we go through these, we are first defining any words that might need some further clarification or definition. And in this case, I think community is a pretty comprehensive word. I think that's not, people don't know it's not that people don't know what community means, but we want to define it in the context of the Iowa Family Support Standards. So a specific group of people living in the same locality may share a common culture, values, and norms, but there might be places in the standards where communities can also be defined by race, religion, ethnicity, age, occupation, political status, all of those things. The term community encompasses work sites, schools, tribes, residential neighborhoods, businesses, all kinds of different things. And so it doesn't just mean your town, I guess is the point. And when we see the word community in the standards, we want to make sure that we're expanding kind of our thought on what it could entail, rather than thinking about it in just one way. So as we dig into the individual, like the second order standards, which there are 3 second order standards under Standard 7, there's kind of a framework for reviewing this and to kind of think, bear with me here, let me get Christy added in here. It's kind of a framework that is important to kind of first establish as we think through each one of these standards, because it isn't just one thing or another. It could be things that take place at a community planning level. It might entail family-specific collaboration, but the end goal then is to decrease those barriers. So Standard 7.01 talks about the organization works and partners with other community providers to coordinate service delivery and increase the likelihood that needed supports and services will be used. So standard is not applicable for organizations that provide only group-based parent ed or short-term in-home family support services. Just because it's not applicable for the standards for those doesn't mean it's not important, to kind of think about for programs that provide those types of services as well. So collaborating with community partners is important for coordinating services and also decreasing those barriers, which are kind of the two takeaway pieces from this standard. So we'll break that down a little bit even more. So there's different ways that this could happen, and different ways to think about it. And I think it's important for programs to think about it from both perspectives. It's not just one way. You can work at several different levels to advocate with and on behalf of people, groups, and families served. For example, if your direct service, what direct service staff are doing might be different than what advisory board members or management or other people that work more from a organizational level, the work that they might be doing. So, your policy and procedure really, from best practices standpoint, could incorporate both. So direct service staff are working individually to carry out those advocacy activities, supporting persons and families to solve their own problems related to their individual cases. And that might mean, helping families advocate for themselves, helping families navigate some of those systems that are more challenging for them, and really identifying even some of those potential areas in those systems that are challenging. For example, I remember when I worked with families and I was making a referral to an AEA for further developmental screenings. If it was during the summer and those AEAs weren't open, it was always difficult to make that referral because they weren't accepting anything at that point. So it might be the middle of July and telling a family, hey, you should call AEA. Probably, even if they did, they weren't going to get very far with it. And so that was a potential barrier. And so we needed to come up with ways to address that barrier, other strategies to maybe get that family some support more urgently if they needed to. Maybe it meant talking to a pediatrician, making a referral there. Maybe there were some other places within the community that the family could be referred to. And then, maybe following up. Once the school year started and the AEA was able to start accepting some of those referrals again, being able to follow, making sure we followed up and address those. And then we a lot of times do see programs thinking about this kind of at that advisory board member or management level, which is great. But the other important piece there is that taking an active role in. So it's not just attending a meeting and being like, okay, attended a meeting, check that off. It's really, being an active participant and being a part of those system-wide advocacy activities. Also working collaboratively with community organizations to monitor things at federal, state, or local levels that impact the service population, making sure that you're on top of things before things get to be too big of an issue, kind of being able to get in on the ground of it and recognizing it before it's like, oh my gosh, this is a really big thing impacting our service population. So this is kind of for those of you that have joined us before, this is kind of our table that we use to kind of talk through some of these things. So as we chunk out standard 7.01 and things that you will want to make sure to think about and include in your procedure, that digging in a little bit deeper and getting the what and the how and the who and the when and the where, those pieces in there. So the part of the standard that says works or partners with community partners, we want to know which community partners. Maybe you discuss that in your policy. When does that happen? How does that happen? Where does that happen? Not every community partnership is the same. So if you say, if you want to build your procedure so that if you weren't there as a supervisor or coordinator for the program, you weren't there tomorrow, or you won the lottery and you quit your job, and the next person coming in, that they could pick that up and know what the work it was that was being done without having to kind of reinvent the wheel and figure it out for themselves. Do they know what meetings you're participating in? When do the meetings take place? Those are the pieces of procedure, like we talked about earlier, that they change more often. So if you're, maybe you need to tweak that every year to kind of re-up those, when the meetings are, those kinds of things. But it's something that it could change more frequently. Describing the purpose of those meetings. So I know there's a lot of meetings that take place throughout the state, like a CPPC meeting that doesn't always look the same in every community, nor will anybody who comes in and reads that know what a CPPC meeting is. So it's important to kind of describe that a little bit more. Talk about, who's leading that meeting, who's kind of the chairs or the co-chairs of that meeting, describing what that is, and making sure that how, kind of tying that to the program. Like, what is the work that you're doing? How does that relate to the program? It should be pretty obvious there in the procedure. But if it's not, maybe there's a kind of a definition there for, like, this is important because, or whatever. And then also, so the where is it documented piece. So how are the peer reviewers going to know about this work? How are they going to be able to say, yep, this program is definitely doing that because I have looked at XYZ. So for this standard, things you might include in your evidence box would be like agendas, meeting minutes, flyers, possibly MOUs. You want to make sure that you include a sample over a length of time, not just one or two. So really showing that don't just throw in the most recent meeting minute and say, okay, done. Make sure that you're showing that this has been something that's been, you continue to participate in. And then also, like, if you've got flyers from the meetings for planning like collaborative community events or those kinds of things, those could be appropriate to throw in there as well. So like if you're partnering with a couple of different organizations to sponsor a diaper drive or something like that, or diaper giveaway, then something like that might be something you put in there as well. And then for the coordinating service delivery, it's, again, which community partners, when, how, where. These things are all kind of the same, but it shouldn't, you want to write it, your policy, so that, and your procedure especially, so that it isn't up to reviewers to kind of have to interpret, well, this is this or this is that. You really want to spell it out for them, because the more that you spell it out and the less that they have to interpret, the more likely they are to find it in adherence, and the less questions that they're going to have at the time of the peer review. So that's really why it's important to have all of this stuff in there. So describe the purpose of the various community organizing meetings, describe the process for family-specific collaboration, coordinating service delivery. And again, this is going to be found in your agendas, your meeting minutes, your flyers. It could be that these things are the same. It doesn't necessarily have to be. Sometimes programs will find themselves coordinating service delivery with a couple of organizations, but then they're partnering, within the parameters of like community planning with a much larger group. So like maybe you get referrals from one particular hospital, and so coordinating service delivery and working through that with like doctor's offices and things like that is a much smaller group. And then that larger group is of all of your community partners it's a different process. The one thing I will tell programs, and that I hear a lot from programs after the fact, is like, gosh, I wish I'd been saving those agendas and meeting minutes. And so this is kind of my reminder here, is this is one of many standards that those will come in handy, but like really save them. I don't know, we don't always, well, depending on meetings are in person nowadays or not, but we might get them if we're physically going to a meeting, and create like a folder. When you get back to the office, you're going to just put them in there. If you get everything electronically, make a folder in your like saved files on your computer that I'm just going to detach these all and save them in a folder. That way, when I know I need them, when I'm getting ready for peer review or getting ready for TA, that they're there, and I can kind of go through those and find the ones that are the best examples for whichever standard it is I want to use those for. But create a mechanism by which that you're remembering to save them. So I hear it a lot. Oh gosh, I wish I'd saved those a lot. And the last component of 7.01 is, how does your policy increase the likelihood that needed supports and services will be used, or decreasing those barriers? Again, this could be the same as the work you're doing with every other community partner meeting or event that you're participating with, but it doesn't necessarily, and you need to make sure that your procedure kind of delineates that and describes that. Again, we see a lot of, we attend these meetings, and this, and the kind of the assumption then is that like attending those meetings meets all of the points of the standard, and that's not necessarily the case. We want to make sure that when peer reviewers are looking for this, and that, the next person that comes in and maybe has to figure out the work you're doing, knows that how each one of these things are being done and what the purpose is for them. This is all about creating purpose in the work that we do and making sure that the work we do adds value to the program and the organization. We don't just do it to do it; we do it for a reason. And let's make sure that we're really capturing those reasons and documenting all of that in our policy and procedure. So again, in the procedure definition, one of the important ones on this one is describing work individually with community partners to decrease barriers, not on a family specific level, but like, some of those organizations that you really partner with a lot or work with a lot on decreasing those barriers. Um, you could list them there, or you could have a reference sheet or something like that. But then also asking community partners to provide feedback on barriers to assess those barriers. And even that might even mean like barriers within your own program. I think that's something to consider. Talking to other community providers and trying to address where barriers are for people that they might be making referrals to you as well. I think that's something we don't think about a lot because we know what the barriers are to other programs, but we don't necessarily think about what are our barriers and what is other people or other organizations or program perception of our barriers. Okay, so moving on to standard 7.02. To promote the availability of full range of community services, the organization point A regularly assesses the resources and services available to families and advocates for needed services when they are lacking or not easily accessible. A couple of important points here. Both bullet points are required elements. A lot of times we see A is pretty, lots of programs have participate in processes for that, but B is also required. So we need to make sure that in addition to A, there's some policy and procedure, and then obviously practice around B. And then also the word regular in standard 7.02A needs to be defined in policy for your program. So, and that's true of any standard. Anytime we see the word regular or something that indicates like a frequency, we need to be defining that in policy. If I were you, if I were a program right now and I was listening to this webinar, I would be pulling that your policy up that's referenced to that standard and making sure that you have defined regular. We are continuing to enhance our guidance on some of these standards, and so this is one of the ones we're talking about. So you want to make sure that maybe previous peer reviews, they didn't really look for that. They didn't look for that guidance on that definition. But going forward, that will be something that the peer reviewers will be doing. So as we kind of break this down, regularly assesses resources and services. You want to describe in your procedure that when and how and who and what. Make sure people know who's supposed to be doing this. Describe that regularly. How often are resources and services assessed? Maybe both within your organization or program, but then in collaboration with other community service providers as well. How are they assessed? Who's a part of that? Is it just the organization? Is it a group of community partners? Sometimes there's a couple of different groups of community partners that are assessing that information. So making sure you're being really clear about like, this group does this, and this group does this, and it's on this group's frequency is this, and this group's frequency is that. This is one of those standards where, well, any standard, you don't want to do this, but we see, we want to make sure that you're not just kind of throwing a bunch at the wall and seeing what sticks, that you're really being purposeful in explaining to peer reviewers or to anybody who might, again, need to pick up your policy manual and make heads or tails of it in the future, like they know exactly what the work they need to continue doing is. And then what information is gathered as a part of this process. I think there's a lot of assumptions sometimes on like what a community needs assessment entails, but that's different depending on who's kind of leading that community needs assessment, right? If it's a hospital-based one or a Department of Public Health-based one, that might look very different than if it's one that's led by another community partner organization like a I'm thinking like a community action agency. Those things could look different. And so, if you're talking through all of those, making sure you're explaining what information is important. And really the hint here is that your programs need to be actively involved in the work, not just using the work of the other organizations. So making sure that you can tie that work that maybe is being done in collaboration with others, but that there's like that your organization, your program, yourself as a supervisor or management or whomever, that there's you know work that you're doing that's providing to that and adding to that, not just like, yep, we do, the community does this every so often and we get it sent to us, and then now we know that you're participating in that. So some things you might see in this one, or that you might think to include for documentation on like how the peer reviewers will know about the work. Intra-agency or intra-program meeting minutes or agendas, documenting those assessments of resources and services. And then additionally, those community meeting agendas and meeting minutes showing that active involvement, documenting the assessment of resources and services. And again, keyword there being, active. Want to make sure that that it's clear the role that your program staff or yourself or whomever plays in that process. And then advocates for needed services. The second bullet point there, advocates for needed services when lacking or not easily accessible. Again, when, how, who, what. See a lot of like, we do it, but there's not that definition. And so, you really want to make sure that your procedure, which is kind of part of your policy, defines those things, describe the methods of advocacy inside the program. So this is going to be kind of those formal methods that happen inside your program, and then describing those advocacy within the community. And then when we're talking about the advocacy efforts inside your program, those them being more formal, this isn't like on an individual family level. That's, maybe you work at an organization that has lots of different, so for LSI, right, we have a lot of different service lines. But some of the work that we're doing to advocate for those work mean cooperation across service lines. We recognize that maybe there's a need for a particular thing, and it crosses service lines. It crosses, early childhood and into maybe mental health. And so there's some advocacy efforts that happen both ways, or maybe there's information sharing, those kinds of things that might happen between services in the same organization. And again, those intra-agency or intra-program meeting minutes, community planning or community meeting minutes, showing that active involvement or documenting the assessment and resources of services. And again, just putting a community's plan or community needs assessment in there isn't, unless it's talking about how things were reviewed for those things that were not easily that were lacking or not easily accessible, and talking about how that assessment was completed. Just putting a community needs assessment might not meet that documentation. So you want to make sure that you're including things that are applicable for that particular piece, because every community needs assessment looks different. And the last one is standard 7.03, which I will say a couple of things about this before we dig in deep. Okay, so first one, this standard is one that takes planning and purposefulness. Like, as we talk through things today, and as maybe you're listening to this recorded webinar in the future, just know that like you might think, oh gosh, we're not doing that, or we're not really doing this like on purpose. So think about and brainstorm ways that you can do it on purpose, and that you can plan for it in the future, and make sure that you're doing this in the future. We see a lot in as we talk through this with programs where there's maybe not that purposefulness, but they recognize, oh yeah, but we do that. So let's just kind of flip that thinking about it, and let's talk about it first, and then make sure that we don't want to be reactive. We want to be proactive, right? And so this is one of those things. And the other thing to know is that like this isn't going to apply to all families throughout the entire family support program. It's not everybody's going to be at that place where they're ready to participate in community planning types of things or community building types of things Especially you've got those families that come in, they're in crisis, they've got their own things that they need to, figure out first. So then once some of those things have they've been connected to the needed resources and they've got all the support that they need, this might be something worth exploring to them. So we're not looking for every family participating in this. We are looking for, do you have a plan for connecting families that are at that place, and what's happening there? So program activities facilitate a connection to the community and promote a coordinated response to community needs by encouraging families to connect with other community members, organizations, and institutions, and contribute time and skills to family support and community building efforts if and when it's appropriate to do so. Interpretation there says some families may not be at a point in their lives where they can contribute to family support and community building efforts. So it's kind of acknowledging that there. Again, this standard is not about making referrals. This standard is more than that. It builds on that. It's families kind of that giving back, and it's again not on accident. It's not like, oh, we have some families that do like that that donate things back to our family support program. It's on purpose. What is your program doing to kind of implement that on purpose and planning for it? So this one was a little challenging to chunk down. So I had to do it in two different ways. So the first part is program activities facilitate a connection to the community by encouraging families to, and then we did each piece. So connect with community members and organizations and institutions. How, when, who does this work? So describe those program activities that take place to connect. Describe the purposefulness behind the work done to encourage families to connect. It's again not making referrals. It's we'll get to some examples here in a bit. So examples on this one might mean group connection agendas, group connection flyers with community members and organizations presenting. It could be individual family contact notes, which would be reviewed as part of the participant file, where individual connections are facilitated. It could be sponsoring an event that is where people that attend that event, or some of your people in your programs, are able to do some work to give back to the program or give back to the community. Sorry, I just had a really good idea about one. So I was kind of like, ooh, squirrel. I was like, wow, nobody's thought of it. I've never seen that one before. That would be a good idea. And then the second bullet point there, contribute time and skills to family support and community building efforts. Again, who does that? When do they do that? What is your program's plan for procedure? And then describing the program activities that encourage families to engage in that community building. Who does this? How is it done? A lot of that is going to come down to, how it's structured within your program. If you have group connections, you offer group connections as part of your program. Could be done there. You would include agendas, those flyers. But it also could be events where you maybe recognize, hey, there's maybe the library has a need for XYZ, and we think some of our family support participants might be able to help fill that need. And so maybe you partner with the library to engage some people to help fill that need, and you hand out flyers to some of your family support participants, to some of your families. It also could be an individual contact notes that are found in that participant file, but I really think if we're including that purposefulness and that kind of thing, there would be more of like on, we want to make sure you're doing it on some sort of time frame. It can't, again, if everything was found in just those contact notes, that would be something we would still want to see some follow-up on, and that purposefulness behind, like making sure that we were really doing it. Because I think that's the case. We might run into a situation where, again, we are getting ready for peer review and talking about this in TA, and it's like, oh gosh, I don't really know how we're doing that. And so maybe it would indicate to me there's not as much like thinking about it ahead of time going on there. So some examples might include, I've seen some of these, so that's why I've kind of included them in there. I love the Earth Day park cleanup event. And this came to me from a program in Southwest Iowa that that's what they did was they encouraged their families to get together and clean up a park, which I thought was awesome. And then they used that to build in, some um, parent-child activities. That was also, and then they talked about, there's some educational opportunities there. It was cool. It was really neat. It could also include advisory board participation opportunities. So if your program has like a parent advisory board or something like that, that might be a place where you build that in. Could include community stakeholder meetings. I know a lot of times, we know about things that are taking place in our community where like the input of families, the families that we work with for various reasons might be sought. Children's mental health is one of them. I see a lot of these on. And so, asking or creating a path by which you could inform families about those opportunities and informing families about like, hey, this is maybe you've got a family that does a really good job of advocating for a child that they have with mental health needs. And so you can use that. Opportunities to read to children at the library, opportunities to mentor new parents. I've seen a couple of those recently, which I think are really cool when you've got maybe like a family that has been in the program for a couple of years, they're doing really well. And maybe you build some kind of framework by which you have a mentorship opportunity from a parent that's been in for a couple of years to a new parent. I don't know, lots of ideas there. Donating used baby items, if appropriate, such as like swings or toys, things that are like appropriate to donate. Opportunities to participate in a program or organization fundraising efforts. I've seen some of those lately too, where a program maybe meets some of their budget needs by doing other. One did like a mud run. They asked families to like participate at the various stations or things like that. Like I've seen some cool things with that one too. Opportunities to volunteer at senior care facilities. And again, that caveat that not everybody is going to be at a point in their lives where they're ready to contribute, and that we recognize that within the Iowa Family Support Standards, but it's also important in that, at a program level, you're recognizing that and making sure programs or families feel like, they're not feeling pressured into participating. The idea I had just recently, just so you know, my squirrel moment a little bit ago, was my mom does some quilting and things like that, and I'm trying very hard to learn quilting. Not very good at it, but I thought that it would be cool to you see those like community blankets where everybody kind of makes a piece of the quilt. And again, this is me, beginning quilt maker, can barely operate a sewing machine, but it would be really cool to make a blanket or something like that, or have, I don't know. It was a squirrel moment, but I thought that was a cool idea. So that is our webinar for Standard 7. It's kind of one of those standards. It was short, but we needed to do some deep dives. But then, it was like, do we include Standard 8? But Standard 8 really goes good with Standard 9, so we wanted to put those two together. So we usually do more than one standard, I guess. Anybody have any questions they want to ask, or anything out there about this, about anything else? I'm gonna turn off the recording so